To be a part of sports medicine is to really be a part of a very vibrant, active community. My patients are the 500 plus athletes here that want to stay active, that want to get back to what they're doing. I think any provider would like that. Being the athlete's primary care physician, I'm responsible for making sure that their health is as good as it can get so that their performance is optimum. They have the luxury of having rehabilitation available to them every day and our attention every day, but their level of activity is a lot greater than ours is too, and that's what's required of them every day. And so it's kind of a big responsibility. So our big picture, and I think this is what kind of sets us apart and around the country, maybe around the world, is the area of concussion rehab. For so many years, I mean, we've been trying to diagnose it. We've got an emphasis now, I think, on prevention. I think we're finally realizing that there's only a few things we can do to prevent it. But what we've realized, and I think it's out of the frustration of myself and our staff, is we just weren't comfortable with the idea of, well, you had a concussion, go to your room, sleep for a couple weeks until you feel better and come back and find us. And we just didn't accept that. And so we were one of the first groups around the country that showed that if the longer you wait to recover without any activity, the longer those symptoms take to get better. And so we start off fairly early in our process by getting kids involved. We give them the rest they need, of course, but that third or fourth day, we're already thinking about, okay, we need to start doing some light activity because that's what's going to start getting them back quicker. So we've developed protocols for that. We think too that our prevention program that we'll begin with our freshman football players, we have already, where we train them with vision training exercises. That what that does is it trains them to recognize and trust their vision, their reaction time, especially their peripheral vision. We know that the hits that hurt the most are the ones you don't see. And so what we do is try to train them to be able to see in the periphery those hits coming across the side to be able to brace for those. And when we've done that, and we've been involved in doing that for now about 6 years, our concussion rate has dropped when the rest of the country, their rates have gone up. And so we think there's something real there. The reason why UC Health is the official provider for the Bearcats, I mean, we share the same name, but with that comes the distinction and the responsibility of having the academic medical center in the community. I mean, at my disposal is every specialty available to take care of just about any problem I can develop 2 blocks away. I think that's the best service we provide, is having that big umbrella across the street that we can tell our athletes families that they're going to get the best care they can possibly get with us here.